Edition of Daily Blast Live. It's DBL's House Call. A panel of doctors are here to talk about one of the biggest medical breakthroughs in decades. Weight loss drugs have a real shot at fighting obesity, but do the risks outweigh the rewards? Then a Bravo star is here to explain why she didn't hide her Ozempic journey. And a diabetic woman who was prescribed Ozempic years before the craze is here live. What was she told about the drug back then? That's all today on DBL's House Call. Welcome to DBL's House Call. Today we are talking all about one of the biggest medical breakthroughs in decades, a new generation of drugs that are changing lives and figures all across the country. Of course, we're talking about weight loss medications like Ozempic, Wegovy, Mounjaro, and Zepbound. And to help us with this conversation, we are joined not by one, but two Harvard-trained doctors, cardiologist and internal medicine physician, Dr. Payal Kohli, looking good in pink. And then we've got psychiatrist Dr. Frank Anderson. And let's not forget, joining us from Detroit, where I was born, by the way, our favorite holistic plastic surgeon, Dr. Tony Yoon.
Thank you.
Thank you all so much for being here. So I'm glad that we have a whole hour devoted to this. In fact, it's been 3 years since the FDA approved Wegovy for weight loss. And in that time, it's estimated more than 15 million Americans have tried them. But these drugs remain controversial for a lot of reasons, so we're going to talk about it. Dr. Kohli, for a lot of people, in order to keep the weight off, they're going to have to be on these drugs for long term, right? Do we know, is it safe for long term? And just a disclosure to our viewers, we are aware, Dr. Kohli, that you do consult for one of these drug makers.
You know, Sam, this is the question we struggle with in medicine. When it comes to chronic disease management, we put somebody on something for the rest of their life. But we don't get the luxury in medicine to know whether or not it's quote-unquote safe. So we use data in the short term to sort of impute the risk and benefits. So if you think about blood pressure medicine, if you think about cholesterol medicine, about diabetes medicine, we study it with short-term data, and then we put people on it for the rest of their life. So we're walking this tightrope all the time. But I would ask you, if you have obesity, which is a threat to your life and to your disease states, would you want to be on this medicine if you've got at least a good data set? And with this particular medication, even though it's been used for obesity only for 3 years, we've been using it for diabetes for 20 years.
There you go. I understand that this is for medical purposes, but vanity is very addicting. And I'm just being very honest.
Yeah.
One thing that I was told by a trainer the first year that I competed was, you're going to get addicted to the way that you look on stage. She used to do fitness competitions. Yes. So, and I understand that in a different way. So knowing it from that angle, but never having been obese myself, I would say I would have to figure out another path. But that's just because of the way that my psychology is.
So can I push back on you on that, Erica?
Please do.
So this
let me get my tea ready. Hold on.
Actually, we didn't even know this, but it helps treat addiction because it reduces that sort of reward from the addictive behavior. So I totally get your point, which is that we don't want this to turn into a vanity drug. And that's one of the reasons the FDA took so long to approve it after it was approved for diabetes, because it's for obesity only. But I think when people start feeling better about themselves, they change their behavior, they change how they're living, it moves them to a healthier place. Now, the difference between this drug and a hypertension or high blood pressure drug, you can see the effects. So that's where the vanity piece comes in, because people look different. Right. And that's the piece that we don't see with blood pressure or cholesterol medicine or diabetes medicine.
Right.
And a number of the people that I've worked with in the mental health realm talk about, the voice in my head is gone.
Really?
I've been preoccupied with food my whole life.
Right.
Is this how normal people have a relationship with food? So this biological dysregulation that happens with eating issues is turned off with these drugs, which is huge for the people that have been struggling their whole life with it.
So true. Dr. Anderson, is there an off-ramp for getting off these drugs? Like, is there a clear path for people to not have to be on them for the rest of their lives?
Right now, we don't know of a clear off-ramp. Some people stop taking the medicines because they don't like the side effects or they choose to get off of them, and you always have that choice if this isn't working for you. The thing that I like to say to anybody about any medication is stop it slowly and stop it under medical supervision. And from my perspective, from the mental health perspective, what happens every step of the way as you slowly taper off of this?
Right.
Super important to pay attention to the fears, the worries, the excitement, all the things that happen. Slower is better when getting off any medication.
But Dr. Yoon, we got to bring you in here because these drugs cause rapid weight loss. So what kind of effects does this have on your skin and your appearance? Have you had to deal with this with some of your clients?
Yeah, I mean, anytime you lose weight, whether it's through Ozempic, natural means, or surgery, typically people do notice loose skin. And it really comes down to the amount of weight you lose. For some people, losing 10, 20, 30 pounds, you may not notice it in your skin at all. Most people, once you get past about that 30 to 40 pound mark, that's when you really start noticing that the skin doesn't quite sit or hang on your body quite as much.
Well, what about when people, like for instance, do people look different after losing weight with weight loss drugs versus losing it naturally through surgery?
So it does not appear that losing weight, let's say through Ozempic or Mounjaro, Wegovy, that's going to cause you to look any different than had you lost it through a different means. I think what is key, though, is the speed at which you lose weight. Not necessarily what you do to lose the weight sometimes, but the speed. And the faster that weight comes off, it's believed that the more potential loose skin that you might notice afterwards.
Coming up on this special edition of